want my crease to be. So what I do is I take my hand at the top and I just kind of hold it over that hip. That's my line. So now I know that I have upper gluteals, or lower gluteals I mean, are going to be available to drape them. So I'm going to be able to get to the greater trochanter. Okay, so that's the first thing. I saw lots of stuff and everyone had the blanket like that. Okay, so that's the first thing to do, is make sure that you get this blanket out of the way. And then sometimes I'll even like tap here to kind of just give myself a, I don't know why I do it actually, it's like probably one of those nervous tick things, but then I kind of do the same thing. I'm going to hold the sheet here down and then kind of get my drape, making sure that my angle is going to be above the knee by like 3 or 4 inches, because if you noticed, each time someone did it, this is what they concentrated on. They went a little bit higher, a little bit higher, a little bit higher. And over time, I've learned that if this crease is at the knee, you're already going to limit yourself, because now I have to travel all the way up, and just going all the way up in seems like you're going higher than you're going. And that is what's like, whoa, you started a way high, even though you're not. You kind of are. You kind of are seeming like you're going high. So if you start your crease high, the air hits the skin senses everything. Now I just go down and in, and I'm not really traveling up. It's safer for her. She feels you're not going up, you're going in, so obviously you're not meaning to do that or anything like that. And then I always pull. This gives me a couple of indications. Is that a good drape? It is in this case. And then, of course, grab, and then come down and tuck. I try to tuck at the waist level so you don't get into the area where some people go much higher and go up into here. I find that can be okay, but if we've got flabby, loose skin, and everybody has that, you get pinch. You have the tendency to pinch. So, yeah, that's what I would say to help you out. And then undrape is very simple. Just pull out there, and then like a tab, pull it, and then you're good. So that's what I would say about the drape. So you're coming in, you're going to meet your client. I would make sure that you go all the way up to the ischial tuberosity and the greater trochanter. Some rocking, some pressing or compression. Maybe down the calf, heel, and I like to just say hi to the foot. One, it'll tell me, are they ticklish? And 2, it usually is a really great way to ground them. So once I do that, then I will so I'm draped. Can I take the sock off?
Yeah. Sorry.
It's okay. So we're draped. Notes. Sometimes it'll happen where this kind of gets thrown up and you've got some access to the other foot. Just make sure that you go back and you cover that up, that foot, however you need to with this excess sheet, this excess fabric. Okay? Okay, from this point on, I have no idea what I'm supposed
Apply
to do.
lubricant using long effleurage strokes.
Okay.
Be complete in your coverage from toes to gluteals 1 to 3 times.
So what I like to do is start at the calf, because now I can work up and work back. If I get an excess here, I can always push it up. If I get a lot of lotion, I can push it up and kind of spread it out, or I can pull it down, get some on the feet as well. And this also helps to serve for if they're ticklish or not, and it's good to know that, because you might have to omit the feet altogether. It depends. So make sure you get down almost all the way to the front of the leg because we're gonna wanna make sure that we get the adductors very well. And then we're gonna get all the way up to the drape line and to the greater trochanter. Okay.
Massage posterior leg. Face feet, thumb over thumb plantar surface towards toes, arch and ball of foot.
So I'm facing the feet on the side of the table of the leg that I'm working on, so the ipsilateral side. And all I'm doing is just going thumb over thumb. I first start at the foot, at the big toe, and then I go between the big toe with a little bit more pressure. How is the pressure, by the way?
Good.
And then I go over top of that tarsal, actually phalange, and then go in between those toes. So the next one, this is the third one, in between 3 and 4, 4, in between 4 and 5, and then over top of the outside of 5. And then I come up a little bit, and now I widen my area to this whole area, so I've gotten all this. Now I'm going to go here, so I'll just thumb over thumb. Right in here's this plantar fascial band. Can be pretty tender. It also can be pretty good to loosen. So I might just do a little bit heavier, slower thumb over thumb there. And then up there to the big toe again, and then just at the bottom of the calcaneus here. And then
From side of table with superior hand in a C, apply circular friction to calcaneus, working into petrissage of the Achilles tendon.
okay, so I have a C. Now I can do whatever I want with this hand. I tend to almost do 2 C's back to back to get what I want out of that. Okay.
Apply petrissage to gastrocnemius, followed by ringing.
Okay, so now I've gotten all of the foot, right? Petrissage, what I like to do is go the full length of the gastroc. So keep in mind, where does the gastrocnemius attach? There.
I'm at the femur.
Where at?
Right here.
Do you know the bony landmark? You guys done
I don't remember.
the legs?
We haven't done the muscles.
You haven't done the muscles of the legs?
Not yet. We're working our way down.
Where are you in the arms now?
Around
Yeah.
the shoulder, yeah.
Oh. It's on the lateral and medial epicondyles of the femur. So you want to make sure you go above the joint. Always go above the joint. So we're going to work always to above the joint, never stopping here. I'm shortchanging ourselves. Always go to the attachments. So the greater majority of my pressure is in the belly of the gastroc, but I am making sure that I just get some attention above the joint. Okay.
Says followed by ringing. Is that what you're doing right
Yep.
now? Okay. Using thumb's muscle strip or thumb over thumb gastrocnemius in 4 to 5 strips.
So now I take my stance. My right foot is at the back of the table. My left foot is in this modified sort of lunge facing the head of the table. So I have the option, and you have free range here, whether you want to go medial to lateral or lateral to medial as far as your muscle stripping, okay? And I would say do that with your thumbs or fingers or both. I actually like to do it both. I don't like to do it with my thumbs because then I have to wrap my hand inside and I feel like it's a little bit less ergonomic for me. So what I do is I'll take my superior hand and use that thumb as the lead, as the plow, and then my fingers of my inferior hand are going to follow and they're gonna actually do a broader, so the first one is very acute, the second one is very broad, and it's kind of muscle stripping, just a larger surface area, even though it's only 3 fingers long, but 3 fingers wide, I mean. So I'll go all the way up to the attachment, and then I'll work in about an inch or so, and you can feel the gastroc. So now, like the belly of it goes right here, so I'm just kind of in the middle of both of them, all the way up. Now I might switch because I'm on this lateral side, so I switch my hands because this doesn't make that much sense to me. Now I feel like I did over here, so I'll switch it. How's the pressure?
Good.
You want to be careful on the gastrocs, and most people, they're pretty tender, especially the athletes, runners, cyclists, people like that, or people who don't get a lot of movement and or body work in. So now I think I did 4 passes there. I wouldn't do another one. I am just doing it just because.
Apply fingertip friction to medial knee with inferior hand and lateral knee with superior hand. What is this called?
Say that again?
Apply fingertip friction to medial knee with inferior hand and lateral knee with superior hand.
So, fingertip friction. So essentially inferior hand, medial, superior, lateral. Okay. And then,
Transition into gentle palmar friction to back of the knee.
which is just simply putting the palms down a little bit more. Now I'm kind of giving opposing forces so that I can kind of give those tissues a little bit more, I guess.
Petrissage hamstrings include adductors and abductors, utilizing kneading, lifting, pincing, and wringing.
So now, when I start on the inside, go to like a horse stance, parallel with the table. Just make sure I get the adductors. Are very important. A lot of the adductors are tight in most people. Using in this case the inferior hand to do a lot of the work when it's close to the drape line, because this hand it's a little bit tougher to get the angle in. Okay.
Muscle strip or TOT hamstrings in 4 to 5 strips.
So thumb over thumb or muscle strip or both, however you want to do that. In this case, I would do the same exact thing as I did down here. I would have my thumb lead the way. My fingers are going to follow. What I'm going to do is just create this kind of maybe 1/4 of an inch in depth. I guess you could call it almost like a plow that's just kind of going through. That's following this lead, which is actually going along and finding the muscle and lifting the muscle up, bringing the muscle to the lateral side, giving it some lift, finding some space, and trying to feel out what the back hand needs to really do, what that following hand needs to do. How's it feel, Caitlin? Pressure? Good. So now I know there's some muscles. That was semimembranosus and tendinosus. Now I'm getting into biceps femoris. Okay, all the way up the ischial tuberosity. Now I might switch. But keep in mind that if you're going to use your inferior hand, you got to be conscious of what your inferior fingers are doing. So I will, at this point, bring them in, or I'll just work fingers here, doing some muscle strip with my fingers. All the way up to the greater trochanter. Okay.
Apply inferior forearm, elbow points medially, I'm assuming, to hamstrings from just above the back of the knee to